right page. So again, it's an introduction to this. For some reason, people often dread the holidays, and I mean, weigh in on that if you do. It tends to be a very, very high stress situation and high stress time of year for people, and we're going to talk about why. Officially, May is Stress Awareness Month, and so one of our presentations we did in May, and it worked out okay. But I think that the holiday stress far supersedes the stress of coming summer. When you think about May. And we're going into this dark season. We're going into this holiday season. It's getting colder. We're getting wind and rain and snow. And so there's a lot of things to be worried about that all need to come together for a happy holiday and a safe holiday experience. But so thank you all for coming. I need to move these guys. I assume you see the full slide there, not just so okay. The important thing about stress is, one, we can't really eliminate stress. It's part of our society. It's part of our sort of demeanor. Our personalities are all geared towards stressful events. Many of us are in healthcare, others not, but it is something that's very important that we understand as part of our life. So the objectives for tonight are just these four. Understanding that it's a part of our life, differentiating good from bad stress, adaptive and maladaptive ways of dealing with stress, which is what we're talking about. The physical impact from stress, I can't underemphasize that it's that when someone has overwhelming stress, their body is really bearing the burden of all of that. And what we try to teach in these short courses is to be accountable for your own stress and to take care of yourself in a meaningful way that lowers stress and doesn't make it worse. And taking control of the things that you can control and sort of letting go of the parts of the holiday that you have no control over. And this will help you develop what they call learned resilience. And resilience now is a buzzword in the stress and psychology literature, because resilience tends to suggest that someone is psychologically hardy, and if they're hardy, they're healthy and resilient, and so they're going to bounce back. If you get knocked down, someone with learned resilience is going to get themselves up and dust themselves off again. So that's very important to remember. And then just a minute about seasonal affective disorder. The days are still getting longer, and they will until the 20th or 21st of December, when winter officially arrives. And so we have to think about that. For some of you, if you work on a day shift as a nurse or teacher, you go out of the house when it's dark out, and then by the time you get home, it's dark out again. So lots of people really experience that affective change or emotional change that's associated with all that darkness and sort of being in the dark, going and coming from work. And so when you're at your job, it's light out, but you're at your job. So you have to really understand that there are some components to seasonal affective disorder that are key, and you need to remember them and be respectful to them. Just so you understand and don't, I'm trying to get away from this, and are not overwhelmed. So there are, the goals are here. We just talked about those. And understand that really a lot of the stress for the holidays, think for a minute. What is it that you're stressed about? And if someone would love to give an example, I'd like to have one, and maybe we could use it as something to talk about. If there's something in specific that you worry about, it might be grist for the mill. But normally, couples, and when they come in for therapy or they come in to talk, they usually express some anxiety that sort of brings them into conflict with one another. And so whether it has to do with the food that's being cooked, the alcohol that's being served, the gifts that are being purchased, the cost of those gifts, there's usually something that has not been discussed that's now weighing heavily on this family and this couple, and it needs to be kind of resolved, if not this year, certainly next. And a word also about, and I want to call out young families, because young families often have a larger share of the stress. Why? Because they're blending their, like a newly married family. One of my sons has just gotten married. And so they're trying to find their way and just to establish their rituals and their normal Christmas and holiday, and Hanukkah. And so it is a blending of cultures, and it really takes some navigation. And so these folks in my family get kind of anxious about this, and they really want to make sure they establish their own rituals, and we have to allow that, and we have to permit them to do their own thing for the first couple of years, and if there's a child, that then to do their own thing with the child as well, and to come up with some ritual that hopefully includes us, and so too do families, more established families whose kids go off to college. They come home at Christmas. The rituals sometimes change. So again, you want to be flexible, and you want to be able to allow new rituals to take place. And that can be fun. It really can be fun. So think for a minute, what is it that worries you? Maybe it's that you won't get all the food done you need to, or maybe it's that packages won't arrive on time, whatever it is, this becomes the stress. And so we then see that stress leads to anxiety, and anxiety, while it's not a bad thing, often leads to feelings of loss of control. And so when someone is feeling stress at the holidays, and I'm talking about real legitimate stress and angst and dread, I sometimes hear people say, I'm just glad it's over. When I come back to the work here at the hospital and it's chatting with people, I'm just glad it's over. I'm just glad it's over. And that seems a little harsh, but those folks experience stress at a very high level, and it's not much fun, or it can be limiting. So stress leads to anxiety, and anxiety is not a bad thing unless it gets too high, because then it takes away from the enjoyment. So there needs to be enough anxiety for you to get your work done and to be focused, but it doesn't necessarily have to sabotage the entire day or days. So okay. So again, stress can be marred. One of the things that how does it grow? How do we feel like stress becomes more of a problem? And becomes more uncomfortable, and raises those feelings of dread in us. They can be marred by just unrealistic expectations. People are just unrealistic about how much a family can actually do, how far they can travel, how often they can travel. And when I was a young father, we had to travel from San Diego back to Boston for our holidays every year. Every Christmas was spent here, and we would have holidays back there. And so that was very stressful, bringing two young children on the plane then. But understand that in our culture, everything is so commercialized, and this is part of the stress that run up to Christmas for sure, that it's so commercialized that there's an external stress as well as an internal stress, but this external stress is going on and on and on, largely from Halloween through New Year's. The ads, the commercials, the pop-ups on your computer shopping whenever you're looking for something on Amazon or some other, it really does take on a life of its own. And so you have to be prepared for that. And resilience requires that you adapt, that you don't just go into the stress and have it mar your whole enjoyment, or have it ruin the party, or have it kind of make you depressed. You can do so by early planning, setting limits, and allowing new rituals to come on their own. So again, those three things: early planning, like who's coming, who do you expect, who do you not want to invite, and how much do you want to have for a meal, what sort of dinner you want to have, and that things are going to take work. And so you plan, you figure out the potential pitfalls and the dangerous things, and then you adapt for some new rituals. And like if someone new is in the family because of something new, a new relationship, say, and which is a very fun stress. That's a good stress. It's not a bad stress. And so that person is going to come for the first time. That's stressful, but it's, we think, a good stress. What if you've had someone pass away in the past year, and this is the first holiday season that they're not in the family, and that's very sad. And so there's a space at the table it's not occupied because that person maybe had the virus or had passed away from some other reason, and it becomes very, very difficult, the holiday, and the first holidays typically are. So coupled with the affective changes that come with the long, shorter days, the longer dark periods of darkness, the stress of the holidays don't need to be overwhelming. A resilient person gets up and takes control of the things that they can take control of, and that's important. And please stop me if you would, and if you want to make a point or share something apropos to this, because I think the most successful holidays are those in which things happen both by plan and by happenstance. So if you can have a holiday that you've planned as best you can, but things fell into place and were joyous, then you've done your job. But when you're at you're at your peak of being overwhelmed or worrying, your anxiety, and I will say this: anxiety is threat. So when you're feeling anxious, there's some threat there that maybe you won't succeed, maybe your gift might not be enjoyed, maybe your food may not be eaten, maybe you won't have anybody come at all, and you'll have had this big plan and nobody shows up. Whatever it is, when the stress gets at its peak, you can't stop that and regroup. It's a little too late at that point. So this is the importance of getting your activities, whatever they may be, and work schedule has to fit into this too. Getting your activities and get them set and understand what's going to happen long beforehand. So if you're hosting, have that defined for you, whatever it means. If you're traveling, same thing. Have your travel schedule set up. If you're driving or if you're flying, whatever it is, you really want to be sure that each of the steps along the way have their goals and things that you can control and to lower your stress, the feelings of threat or fear. So this is what stress is. It's your body's response to what is perceived to be a threat. And so when people are under stress because they're in the war and they're in our military, they feel stressed because they're for valid reasons. Police officers feel stressed, nurses feel stressed during the core high crisis times in their work. And so you can't often switch completely on the fly when you have a peak stress period. You have to kind of adapt and slowly change. Now, just a moment to say there is so much literature on stress management and managing stress and suggestions for managing stress. We did a presentation on dealing with stress during the coronavirus crisis. This is when we had a high incidence of viral load, and our staff had that, and our doctors were affected, and the nurses were affected, and our patients were affected, and so it became very, very stressful on everybody, and we were a little bit, sort of on the ropes there for a bit, and then we sort of pulled it together. We did a presentation. I had Dr. Chiquette ask me to put something out about stress management, relaxation. So we put them on the units as like 10 recommendations on how to deal with these kinds of issues. And they're not much different from dealing, we're going forward now. And so we'll talk about that as we, in a minute. So, again, this is just a comment about just where the stress comes from externally. By every day and every third commercial is something about a new car and something about, places to go, something about holidays. And they sort of idealize these people living in large homes and entertaining families with sumptuous meals, and they don't show the stress that goes along with that until the ribbon blows off the house and goes onto the car, and the father comes and says, "Oh my God, you got me this for Christmas," and it was an accident. It wasn't his. It was the son's, but the son couldn't say, "No, Dad, it's not for you. It's the stress of losing a brand new car." So again, it was kind of funny, but not so much that it does push you and push people to come up with these ever sensationalized gifts for spouses, special anniversaries, children, maybe children who are at milestones. Tell me how many kids who got their licenses hope for a car at Christmas. But I don't know. So this is really one of the first times, I think, since the coronavirus that maybe all families have gotten together, or that we're sort of okay to get together with our entire families. And so as we try to return to what our normal experience is at the holidays, whether it's at a grandmother's house or your house or my house, whatever the normal is, as trying to get back to it, you really have to address and at least take a few minutes to talk about what it was like when we couldn't get together. And that may sound unrealistic, but I think it's important to really note, especially if you've had a loss of life, loss of loved one in the course of the last 3 years, for whatever reason, just to remember, to look at our blessings and to remember the things that we have endured, and to not acknowledge that. And that might bring, a more joyous event, a way of really coming together with that celebration of life and celebration of being together with family. Again, certainly the things that people worry about this Friday, Black Friday and Cyber Monday is just so overdriven that we certainly are affected by that. Financially, you have stress about how much money you can spend at the holidays. Is this the first time since the coronavirus you've gotten together? The physical stress of longer days, getting things done, getting shopping done, getting cooking done, all of those things take their toll. And certainly if you are a new family and you're bringing in-laws in for the first time, that's a stress of it's on its own. I mean, hopefully it's a good stress, but if you've done it before and it's not a good stress, then you have to balance out how you bring these people that may not like each other get together, and it's sometimes dicey. But if you think about it, you and your spouse, whoever's hosting, has to have an idea of doing that and having that in place. So again, the commercialization of Christmas and of Hanukkah and other holidays, it definitely plays an impact on how we feel. Many of us feel like we want to do more. We want to, get for our kids and get for our spouses whatever it is they want. But it's not realistic, and to go into debt over the Christmas holiday is not a healthy. It's not an adaptive response to stress. It's more of a maladaptive response to stress, unless money is no object. But so think about whether this is a healthy response or an unhealthy response. And we want you to take a list and build the list of healthy responses and try to avoid some of the unhealthy ones. And we'll talk about them a little bit more going forward. So we want to avoid that catastrophic holiday dinner or the Christmas morning that just was outrageous. And so to do that, we have to plan, we have to control the thing, take control, identify what your ritual will be. You have to decide and set the limit. Come at 4 o'clock, don't come at 2 o'clock. Bring this or that. If they offer to bring something, you share the load. You allow, because people like to bring food items or dessert items, and so you can share that and delegate that to somebody. Okay, so ultimately we want to think about good stress and bad. We've talked a little bit about good stress, and people can put it in the chat box if they so choose. Let me just see. Okay, so good stress is generally fun and rewarding. Okay, fun and rewarding. If you're biting your fingernails and feel angst and I can't wait till it ends, that's not good stress. Seeing family members reconnect, seeing children play together, cousins perhaps come for the morning, and your family goes to somewhere else in the afternoon, just getting the ritual kind of back on track from where it was 3 years ago. That can be fun and rewarding. The outcome is better and good if children are able to lay down new memories and to talk about the Christmases of past. I know that when I talk with families who are here for the holiday because their loved one is in the hospital, they often talk about how much fun Christmas was before when they were younger. And lots of us have those positive memories from our childhood. But sometimes they're not realistic and they're not actually accurate. So if you're a 7-year-old boy, you might remember something that really wasn't as grand or as healthy as you might think, because we protect our kids from that. But so you really want to make sure and create events that allow children to play and be themselves, maybe help you with cooking. Some dessert items, kids like to bake and make cookies and stuff. So just create an event, create a time when children can get memories and can share the old ones and take time to talk about new ones. I know we do certain rituals, reading books on Christmas Eve to children who are there and to grown-up children who are there, and that's a lot of fun. The bad stress, when you see it, it evolves out of negative experiences. It evolves out of negative expectations. Negative expectations that might not be warranted. It might not be fair to say, now this is going to stink. I don't, they're coming this year. They didn't come last year. If they come, it's never going to be much fun. Whenever you predispose or you are prejudiced against what might be planned, that's a bad stress. And generally speaking, if a stress is bad, you're going to maladaptively adapt. You're maladaptively, dealing with that. And what are maladaptive is not taking care of yourself, not allowing yourself to quiet your body, to debrief after the fact, to drink too much, and other kinds of negative physical activities. And so you don't want to be that person that drinks too much and has a bad outcome. So there's always somebody in the crowd that's very good at organizing activities. And so that person is your go-to person that can help get kids playing outside, kids doing games, kids doing projects like when we do doughies, those clay doughies that you color and then cook, and they become hard and real nice for your tree. So good stress is controlled events that lead to greater quality of time together, whereas bad stress does not, for those reasons that I tried to give you or explain. So if you find yourself, you say, what is all this about? Why is it that I dread the holidays, and why is it that I can't figure out how to have a good time? Well, you're overthinking. If you find yourself when you've planned, you've decided who's going to come, who's going to bring what you're going to recommend them to bring, how you're going to present gifts to people, if that's what you do in your routine, in your ritual, your family. You can set that all up so you understand what the sequence of events are going to be. If you need to overthink about potential pitfalls, then you're overthinking, and you're not going to be able to relax and enjoy yourself. So it keeps you immobilized. And so if you're not there to relax and feel as though you're having no control raises your angst, and then it gets harder and harder to experience the joys of Christmas. Now, where does this come from? Well, first of all, it's the human fear circuit. Now, we talked about this a lot in the spring when we talked about burnout. Too much anxiety in a job setting, too much anxiety in a Christmas setting or a holiday setting raises the fear index, because your fear of failure, fear of not making the right food, fear of not giving the right gifts, fear of not making people happy, fear of not keeping the house clean, whatever it is, you're overthinking everything, and then you're going to burn out, and you won't be interested, and you won't have fun. So family dynamics often trigger lingering memories. We want those memories. We can talk about those memories. Do you remember last year? Do you remember the year before? What was that like for you? The kids often talk about remember this, remember that. Pets are always involved in the Christmas and holiday events, and so it's a lot of fun and can be really joyous and where we can count our blessings when we have those moments. But if the fear circuit, the fear is where the threat comes in, the stress touches on a part of the brain that elicits the fear circuit, or it activates the fear circuit, the circuit in the brain, the amygdala, deep down in the brain, that feels like, under threat, some danger here, and then you feel that physically. Your breathing can become more rapid. You may not focus as well. You may be distracted by things and trying to overcompensate for the things that you're worried about, and you might just blow it and have an emotional breakdown, and for a moment you have something go off. So family dynamics are something to think about, especially when two families are coming together as one. Married kids, and now they're coming together and they're wanting to kind of establish their own routines and so forth. When there are little children involved, that they're getting overstimulated by the commercialization of Black Friday, and it can be very demanding on them, and they put it on you, and it's a lot, and so you really need to deal with how to either downplay the gifts they're asking for, or upplay, suggest something else. Again, it's not necessarily a bad stress, but it could be if you're not thinking about it. So again, we want you to know where it comes from. Again, our environment, stress is everywhere. We have a lot of things that we are dealing with as a society now that are, also lambasting us with news about wars, and news about holidays, and news about gas prices, all the day-to-day awareness that we have to pay to our lives, kind of keep us activated and stressed. But we have to really take control of that Mindfulness, when we talk a little bit about the techniques to get over this, one is to take control of it, and two, to be accountable for it. In our first slide, I talked about or mentioned stress accountability. We all have to be accountable for our own management of stress. We have to be accountable, meaning that you're the mother, I'm the father. We have to take it upon ourselves to negotiate what the ritual and routine is going to be, and then manage our own stress. And that means taking care of yourselves. Got kids too, but taking care of yourselves so you can take care of them. So what are the anxiety? What is the fear? Fear of being judged. Maybe this new mother-in-law is going to judge you as your cooking prowess. Maybe your dessert won't meet the standard. Maybe you'll serve the wrong scotch, and that'll come up, or you won't play the right movie on television. Instead of the Miracle on 34th Street, you'll play the kid that gets shot in the eye with a BB gun. You know, that movie. So that means a lot of things that could go wrong, but they don't necessarily have to kill the day and make you overwhelmed with stress. But that said, it's important to understand, and this is from the World Health, this particular, I like the graphic, the World Health Organization, but the Journal of the American Medical Association, the Mayo Clinic, a group called Mindfulness has a website that is tremendous about stress. You Google stress and you'll find hundreds or thousands of good and reputable sources to grow your knowledge about stress. Understand that stress activates our fight-flight response, activates our parasympathetic sympathetic mismatch. The sympathetic nervous system is activated when you feel stress, and it causes your blood pressure to go up. It causes your fingers to become cold. Your some blood vessels shut down that aren't essential. It can make you sweat. It can make you cold. It can make you fearful. And there's a whole host of physical signs that go along with it, and autoimmune like responses that are associated with that fight-flight abnormality. We see it in patients here that they're kind of targeted and by the stress they feel for being in the hospital, and we try to normalize that for them. And I'm trying to normalize it for you in some way, but realize the inflammatory response is that fear response. The fear response comes from the activation of the sympathetic nerve, and the parasympathetic nerve you have to learn how to take care of. How do we quiet our bodies? Well, you go to sleep. Okay, so that maybe that's not working. You quiet your body by pumping the brakes on this and on the sympathetic arousal. How do we do that? We do that by our breathing. We do that by our inner peace and finding a space in our house or our room or our home that we can just kind of down regulate, pump the brakes on the arousal, and find that inner quiet spot that you need. You see this, the physical signs of stress: headaches, not feeling hungry, a lump in your throat, stomach pain, upset stomach, back pain, thigh muscle tension, shoulder, neck pain. When I see migraine patients that come in and they're sitting like I am now, tense as anything, and all that trapezius and energy going to keeping the trapezius muscles just tense, all that blood is caught up in those muscles, and it's not able to flow through the body and relax the body and help you feel safe and in control. So the this is important, and we can talk. There's a bunch of things we can talk about. We know that though when we teach people how to reduce stress in whatever form, stress management tips, classes, individual advice, counseling, yoga, deep breathing, we see decreases in some of the inflammatory side effects. Okay, so this is from the Brain and Spine Institute at Cornell. Okay, that makes sense. Now, and I have a biofeedback system here at Whittier, and I am able to hook people up and teach them, show them where their body is having stress. Often it's muscle tension. Often it's their breathing. They're breathing too fast and not deeply enough. Often it's their heart rate. It's going too high and it chugs along at 90 when it really should be 60 to 80. And they're working. Their body's under stress. And famous book, The Body Bears the Burden, gives you a lot of information about that. And ironically enough, we had a patient here whose wife published this book, and she gave me a copy of it. It's called Dial It Down, and it's about it's really written by an OT, and it's about the body's response to the somatic overstimulated, being somatically. Some kids get very anxious and aroused by different somatic feelings, different textures of clothing, the tightness of the clothing, and so forth. And so the book teaches us how to dial it back a little bit with kids, but also it gives some very good information about dealing with the kinds of stressors we're talking about. So again, thinking about that, we teach people how to reduce stress, and there are the Mayo Clinic, the Cleveland Clinic, UMass Memorial has a great stress management program with John Kabat-Zinn, who's there not only as a consultant, but he's got great people in there. If you want to go for a stress assessment, you can. But the things that they recommend from that may kind of come into your awareness and you say, well, okay, but I can't take yoga class. I have no time for that. I can't go to therapy. I can't practice deep breathing. It doesn't seem to work for me. Okay, so that's what we get, a lot of pushback, or they'll work at it and try it. And we have a couple of different take-home stress meters that I allow people to borrow, and you can show them when their body is in a cohesive, stress-free area where there's a good balance a good balance between the autonomic arousal and the parasympathetic, kind of down regulating that. Then you can show them, this is where you want to be, and this is how you do it. And they say, oh, that's awesome. And they like learning a new technique, but then they stop doing it. And they get good relief at first, and they stop doing it. And that's the problem. It has to become something that's overlearned, and that you regularly, routinely practice and build into your new ritual. That this time, maybe it's after Thanksgiving, or maybe after Christmas dinner or Hanukkah dinner, you take a walk. Now, as a child, we used to do that all the time, but there would be 14 or 15 of us taking a walk. That wasn't so much fun. But as we've gotten older, people want to go off and take a walk on their own, and that's one way to kind of give yourself a few minutes before the cleanup or before the whatever party really gets started, is to do that. So remember, we talked about resilience at the beginning. Resilience is getting yourself back up, having the hardiness to deal with things that you didn't expect. They brought somebody new, maybe 2 people came you didn't expect, or in my case, in the family, someone will always come and bring their dog that we didn't expect. And the dogs they bring are not always the well-managed dogs. They're the ones that jump on the couches and in the bathtub. So we don't expect that, but we are resilient. We'll handle it if it comes. That's the thing. So resilience is not going to make these problems go away. It will make you see past them. Okay, so you'll see it for what it is. It's the family, something you want, something you love, but there are pitfalls sometimes that come up along the way. And to be resilient, you need to get through that and allow yourself to feel the enjoyment of the season and deal with the stress in like taking a walk, like taking a few minutes to be thankful, and taking a few minutes to talk with individual people at the group and quiet things down at your house or at your party. So again, stress is a manifestation of the human fear circuit. The fear circuit is activated when we are under threat. Say you believe that someone is going to not appreciate something about your meal or what you're wearing or what you've cooked or what you've purchased. The fear circuit is activated. So there are ways to learn. Resilience is a way to learn how to, a resilient response to that is to lower that feeling of arousal. And remember, anxiety comes from not having control. So the fear is the anxiety. Anxiety raises to a point where it becomes overwhelming. We like it for some points. Certainly athletes need anxiety to be focused. But if it goes too long and too high, then it becomes overwhelming and the organism fails, or the person in this case is overwhelmed by the situation they're facing. So those who are more resilient are able to move past obstacles. It's like someone will say, "Oh, I'm bringing my dog." Okay, and they may not like it, but they may not say anything about it, and it may not be a killer for them, and they get through this obstacle. Or maybe you'll have to change the venue. Maybe you have to go from someone's sick and you have to go to their house because they're bedbound or they're have a surgery recently. I mean, they're not virally sick, but they're frail, and so maybe you go over there during part of the day, and you didn't anticipate that. So again, you've got to have the skill set to deal and flexibly move through this maze that the holiday brings us. So again, it's called habituating stress. You have to learn that every single stressor is not one that's crippling, and it's not one that needs you to fall to your knees and pray for something different. So with resilience comes an accommodation and a habituation of the stress. When somebody habituates, it becomes a habit. It no longer is a high stress situation. So if you can normalize and become habituated to that person each year bringing a dog or two dogs, maybe this year they're going to bring three. Okay, yep, I expected that. That's okay. So you've habituated that stress response rather than saying, "My God, what are we going to do?" And you talk to them and have them keep the dogs outside or keep them in the garage or in the car or something like that during some times of your time together, the family time together. I don't believe should center around the dogs. So habituating the new experience, that's the important thing. And again, I'm calling out those new families who have young children, new babies. Sometimes the rituals have to be changed, and you have to define new rituals, asking them how they want to participate in family rituals and what do they see themselves doing. This was really a slide that came from the PET scans of people who are under high stress. And so the important thing is you see the PET looks at the lighting up of the tension in the blood and regions of the temporal frontalis muscles or the neck muscles there on the lower in the neck. You can see some trapezius is here and certain parts of the neck muscles. Anyway, so resilience is a mindset. This is an example of somebody that's dealing with stress or experiences stress. It's very interesting to me where they see it, where it shows up in the stress points, in the tension points, mid back, neck, certainly in parts of the head. That certainly is part of the stress response as well. So we a lot of us are in the business or in the field of health related concerns, either as providers or caregivers. So I think that it's real important to think about how stress affects us in a negative way, It brings on the inflammatory response. It seems to worsen or increase the risk of conditions like obesity, heart disease, chronic pain, Alzheimer's, dementia, diabetes, dementia, depression, GI problems, and asthma. I worked at a pain clinic for a while, and an adolescent clinic for a while when I was first training, and the asthma clinic for the adolescents was very, very high stress, and those kids, when they would be in school and somebody was bullying them, or there was some stressor between friends, they would become wheezy, and they would their body's response to that stress would be to close up, and they would have to go into the hospital for a day or days. Usually it was a week that kids would come into the Boston City Hospital and with an asthma response. They'd go on steroids, and they'd get other medications, manage their conditions, and then the asthma would abate. And meanwhile, it was my job to really kind of help them link and see the association between things that might be stressful that cause or trigger that asthma response. So again, it's an inflammatory response. Asthma is an inflammatory condition. And so there you go. But even things like Alzheimer's, something as serious as a dementia can be triggered by chronic conditions that are high stress and influence the body's inflammatory process. And they now believe that there's an inflammatory blood-brain barrier that crosses and creates some of the tau response and the proteins that are found in the brains of patients that have Alzheimer's and other dementias, because it certainly can contribute to cerebral vascular kinds of conditions and ischemia in the brain. So it's a worry. It's a worry. So we want to think about that. We want to manage our the mindset that helps us develop the resilience response, or learned resilience. It's a real thing. If you wanted to Google learned resilience, it would tell you some of these things that we want to be thoughtful about and control our bodies a little bit better as we get older, and as our stress becomes more pervasive during the holidays and other times as well. So resilience is a mindset that can be taught, changes over time. Remember, new rituals. Our kids are growing up and they have their own rituals. Some may not even want to come home for Christmas, and that's something that throws some of us off. But resilience is something that is in our control. So we can really choose how to respond to the stressors or the threats that we experience. Think about that. We can really choose. Our own management strategies can teach us, and we can choose which stressors are most important to downregulate and which stressors are more a good stress that result in an outcome that's pleasurable rather than an outcome that is not pleasurable. So things like drinking, drugging, spending excessively, gambling, often are the sine qua non of bad stress responses, maladaptive stress responses. Adaptive ones, I think we go into it next, are things like just being aware of your feelings. If you feel embittered, which is morally indignant for something that's long been a history in the family, and we've seen that in many families that I've taken care of, then that will be it, and you'll feel that way. But you have to acknowledge that feeling, and let me just sort of. So, okay, reach out for supports. That's key. And if you've got a friend or a family member that you really trust, that helps you, that kind of keeps your head on straight during the stress of holidays, during the parties, during the shopping situation, maybe you do things together and that helps, reach out for support. Maybe not, it's not your spouse. It may not be someone that you're living with, but you may have someone that you trust, that you love, and that you can go to when the stress gets too much. So we can limit these stressors and habituate the amount of autonomic arise we get, that fight flight response, by certainly planning ahead a little bit. By planning ahead, you have control. Okay, we're going to do this, this, and this, 4, 6, and 8. We close the door at 8:30. Just an example. So you want to plan ahead and have some control over the events of the holiday season. Because when you're dreading people coming to your house, you're dreading having to go shopping, you're dreading having to cook, it's not going to be any fun. If you can reach out to support, plan ahead, have some people help you out, delegate some activities that are not so essential that you must do, then you feel less stress and you'll have more pleasure, you'll have more fun. Learn to say no. Don't bring the dogs this year. We have a couple of babies that are wandering around, walking. Don't bring the dogs. Sorry. I think that's fair. And then, acknowledge your feelings, keep up with healthy habits. Lots of people realize they need to exercise. The best way of dealing with stress is exercise. My colleague here, Dr. Bersani, says you can beat stress by vigorous exercise and regular vigorous exercise. And that's from a man that does a triathlon once or twice a year, a full triathlon. He just finished it, and I'm very proud of him. So, vigorous exercise is one way to get through it. If you overeat, overdrink, you're going to feel bad. You're going to feel physically unwell, and you'll feel emotionally disappointed with yourself. And that can turn any number of ways bad. So is that a good outcome? Not necessarily. Is that a good kind of stress? Not really, if that's what happens. If you wind up kind of slinking through the last half of the holiday, not waiting until the kids can go back to school, then you've overdone it and you're immobilized by the stress. So keep up with your healthy habits and or begin to recognize those things that you do that make you relax. We talked a little bit about others, and I've got so much here I can use, and I will. But so this is to really keep you in charge, keep you on good physical functioning, and take charge of what you want. Avoid being bullied by family members or neighbors or anything like that. I just wanted to, the American Psychological Association indicates that 88% of people in 2018, 88% of people felt that they were very stressed at the holidays. The 2018, that's just before the 2018 Christmas. 2019 is when the coronavirus was first diagnosed. Other things that women tend to shoulder more of the responsibility for holiday shopping and preparation and planning, and sometimes that becomes a source of stress, and at least for the woman, and there needs to be some negotiation there on that one. 27% people surveyed said the stress started in the beginning of November, and that they were dealing with it for over 30 days, and it gets very, very fatiguing over time. The people over 30, those folks that I called out, maybe they're starting a new family, new relationship, new routines and rituals, they feel a decrease in stress rather than an increase in stress, according to the American Psychological Association. So that's just a couple of different things. So it really, children look forward to holidays year round, and parents have to be aware that the children have an expectation of the magic of holidays, and sometimes that's not always easy to produce. And so you have to be at your best if you're hoping to make this holiday the best Hanukkah, the best Christmas, whatever season you're experiencing, whatever holiday you're experiencing. You have to be good to yourselves. Take the time to do the routines that you've set up, but also give yourselves breaks in between. Delegate. Don't be afraid to say no. Don't be afraid to introduce new rituals by asking those 30-year-olds, those new families, what they would like, how you can fit in, how we can share those magical rituals that kids remember. And you can talk about them with your children as they grow up. A 17-year-old child is not going to want to get up at 6 a.m. and wait to see what Santa brought. It may be more like noon, and he'll wait for that. So adapt, and you won't feel so egregious or egregious about what. It can be flexible and resilient. Okay, so don't let the if you're feeling the blues, remember a lot of it has to do with the seasonal affective stuff, the shorter days, colder days, but depression is often reflects and represents a loss that you might feel, and anxiety represents a loss of control over something you're wanting to engage in. And so habituate some of the things that you have no control over. In other words, let them go, so they don't trigger your anxiety and in some cases your anger without any real meaning. Let it go, and then or take charge over it. And don't put yourself in a situation where you're choosing maladaptive behaviors to deal with your stress. Use adaptive strategies, mindfulness, breathing techniques. What I always say to people, 3 breaths in, 4 breaths out. You don't need a lot of expensive equipment like we have. 3 breaths in, 4 seconds out. Okay, that's 3 breaths in of 3 seconds and 4 seconds on the out. So take time to be present. And I would be happy to send the slides, and send Joanna a note if you want to have a copy of the slides, and then the stress management strategies that we posted on the nursing units, just for times when things were really hot and stressful. Take time to be present. It's quiet your mind, even if it's just a few minutes between visits, if people are coming, if there's carolers, or if you're going to carol, whatever it is, take a few minutes to give yourself that time just to kind of quiet your body down. That just takes a few seconds or a few minutes. If you practice it, and we teach this to law enforcement, and so that when they're going to a very stressful event, they've quieted their bodies down in the 4 minutes they took to drive there, and bam, they're much better on their feet. They're much more resilient at dealing with the adversity they may encounter in their jobs. And the same goes for medical staff here, our physicians, who some of whom are watching, our nurses, some of whom are watching, and are really in a significantly important role. That patients are coming here for our expertise, and we need to have that right there and available to them. Again, for your own benefit, exercise is key. Stay with those routines if you have them. Start to think about establishing routines that you can use to help you at other times of stress, like in May when the stress month comes up. Avoid the overuse of alcohol. Don't start your diet just yet, because that can cause stress. Allow yourself to enjoy the holidays, and then come to some negotiated place of resilience to get back on your feet and get back into a routine of exercise and healthy diet. Well, this should have been more emphasized, but avoid over screen time, too much screen time. I know the tendency is to have 4 to 7 hours a day of screen time. So if you've been with me for an hour now, that's plus whatever else you've had this day. So you want to avoid having extra screen time during the holidays because it can affect your brain and it can affect your sleep-wake cycle. And some people do put that orange tint. It takes away the blue light. They believe that it's the blue ultraviolet light that can kind of stimulate the brain and interfere with sleep hygiene. So just let that be a lesson to you. Bind your anxiety by relaxing and by habituating and becoming resilient over those things that are anxiety provoking each year. There are some things I'm sure that result in your embitterment, maybe some indignation about things that occur every year during the holidays, and those you must negotiate or eliminate. And so that's the take-home message for that. Thank you. I really want to emphasize that stress does not have to be something that burdens you. We can't turn it off, but we can manage it. We are balancing a lot of things at the holidays between the commercialization of the holiday, the events of families coming together, the time away from work and school, and the both the good and bad stressors that we experience routinely. And so I will say that you can manage it with a fairly minimal changes. And if you get a routine, establish your routine, and the resilience will come from there. And you'll feel like this is a piece of cake. So again, have a schedule, a calendar, and everything will become much more easy for you, and you won't be distracted by people in the room. So no, so that's it. I want to thank everybody. Have a Merry Christmas. Again, thank you to the administrators here at Whittier for allowing me a chance to do this. And I hope that it's useful. We really want people not to dread the holidays, but to embrace them. I guess it wouldn't hurt to go to church too, if you are so inclined, because that helps us kind of center ourselves again, do things that help you feel better and help you calm. And sometimes that does. And be with friends that you like and that you can be yourselves at, and without having to take on a different identity. You want to be yourself and appreciate yourself and reward yourself for doing the job you do and for taking care of the family as you have. And a lot of that falls on the women. And so let that be a lesson to us. We want to take care of our women and help them and help our families kind of succeed with that. So we have a lot of people here. If you want to ask a question, feel free, or comment. I will turn the background noise off. And I see Tina O'Leary here, and she could unmic, open her mic up.
Hi.
Tracy. Hello, Tina.
Hi. Thank you for the nice talk. There's a lot of positive things there.
Well, thank you very much. Have you ever felt stressed at the holidays?
Of course, of course. I had to laugh because I'm not known for my culinary ability at all. So when you were talking about feeling stressed that people were, not going to eat your food, like that's my everyday life. So
yeah.
People will be stressed if I bring food. Christmas dinner. Well, I bring vegetables and dip, and I did at one point forget them. So that was a little bit of a stress, but I had to laugh.
Well, you can practice making one over the next 12 months and get really good at it, and bring that next time you go somewhere. Have it be, this one dish that you've never brought and you've learned how to make it really well. But I
understand. That would be a Christmas miracle.
Okay, well, miracles can happen.
That's right. They can. They can.
Well, I hope it doesn't become a burden. You have to acknowledge feelings. Remember, in one of the slides it says feel your feelings, recognize your feelings, and by accepting that, you habituate that angst that it brings up. You get rid of that feeling. Oh no, people are going to judge me for my food, and then it will go away. It will go away, and
Yeah.
you be aware of the strengths that you have in organizing other things and doing other things, and the weaknesses you might have. And so that's
Very true.
a positive response.
Yes. Thank you.
You're welcome. And anyone else? How about Mary Z? Do you have anything you would like to offer up? Or the Fire Tablet, Molly Powers, Sarah? Don't feel like you can hold back. And also, if you'd like a copy of the slides, I will give them to Joanne Swiderski, and she is our education coordinator here. She can certainly share them with you. They're all referenced, and this information is available to you, not just from me. It certainly is. There's other courses that are being taught on stress management. There are hospital programs for people who have high stress and burnout. Because remember we talked about anxiety, loss of control, and if it exceeds what is within your limit of tolerance, you're at risk of burnout. And we don't want healthcare providers. We don't want moms and dads burning out and being maladaptive in their choice of behaviors as a result. Again, we want to choose healthy things to manage our stress, not unhealthy things that make our stress feel worse in the long run. So that's good. And for those of you who have new families coming together for the first time, it's a wonderful experience. It changes the feeling, but it's no less exciting. It's no less loving and wonderful. Just enjoy that. And I know many of you have new members of the family, babies that have come in the last year, and it's just the most glorious time. And so we welcome them, and we welcome their families, the extended families often, and you can't ask for anything more than that. And that's what life is all about. And so if you're dreading the holidays, and this is I hear people, I'm dreading it, I'm so glad it's over. That's where you need to start and say, what are the things that are making me dread? And often it's being judged, anxiety around things getting out of control, too much drinking, too much music, too much dancing, whatever it is, excess, and that becomes something that's less tolerable. So to some people. So, but thank you all for visiting and spending time. And it's a good group. We will do it again in the spring, and maybe more on back to healthcare, but just in the May is stress awareness. But you're aware of stress and understand it a little bit better, hopefully, and have got a few tools that you can use to manage it. Mindfulness is you'll find that in every single book that you read on stress. And the second thing, and I didn't spend a lot of time on this time when we had our stress for the healthcare workers, where it comes from in the brain and how primitive the stress response really is, and it can really hurt you. The amygdala being a fearful, people that have panic disorders, they're afraid that they're going to have no way of controlling things. That can be very stressful, and so another time we'll talk about the neurobiology of stress. I did that for the law enforcement, neurobiology of police work, being under stress, high stress incidents. So if you're all under a lot of stress, it may behoove you to sign up for the May class.
That sounds good. Michael, thank you so much.
Okay, you're welcome. You're welcome, Joanne, and thank you. All those people have a nice Thanksgiving and Christmas and New Year's. It's great.